Our next guest that we want to bring in is Jaimie Clayton. She is the president and CEO of Oakland Family Services. Jaimie, we appreciate your time this morning.
Thank you so much for having me.
For those not familiar with the Oakland Family Services, can you give us a rundown of what you offer and your mission over there?
Absolutely. Oakland Family Services is a nonprofit private agency. We're a family service agency, so we serve the entire family from actually pre-birth or neonatal all the way through older adults. Our mission is to provide individuals and families the opportunity to build brighter futures. And we do that through our programming, which falls into three categories: prevention, education, and treatment. In prevention, we're really working in that sweet spot of 0 to 4-year-olds. It's mostly home visiting and parent support programs, foster care, adoption. We're really working to prevent abuse and neglect, or at least stop it from happening further, and working to prevent trauma. In education, we're very proud that we have two Great Start Readiness preschools. So that's a state-funded preschool program for 4-year-olds who are at risk of entering school not ready to learn without prior intervention through a preschool program. We do tuition-based childcare at both of those centers also. We also do a United Way funded program where we help to actually train child caregivers to provide higher quality childcare, whether it be in their home or through licensed childcare centers like ours. And then in treatment, we do the full scope of behavioral health treatment, mental health and substance abuse, counseling, and services, again, through children all the way through older adults. We're a specialty provider of substance abuse treatment services for adolescents and pregnant women or women at risk of losing their children due to their substance use. We're also a provider for Oakland Community Health Network, which is the community mental health provider in Oakland County. We specifically serve 7 to 21-year-olds through that service. So we do it all.
You do it all, and in
We
the
do.
middle of a pandemic, there is such a need for your services because we are hearing abuse is up, substance abuse is up, domestic violence is up. But at the same time, you're limited, I would imagine, in the ways that you're able to reach your clients and the people of the community. So, how are you trying to navigate bridging that gap?
Yeah, well, we have been saying since March now that while the buildings were closed, we were still open. So I'm so proud of my team. We pivoted in less than a week to 100% virtual services for those funders that allowed us to do so. The only service we weren't providing immediately was our preschool and childcare service. And within 2 weeks, we were even providing that service, connecting with families and providing some enhancement educationally. So luckily in Oakland County, really all of the funders through the state, the county, our various grant funders, even the insurance companies really stepped up and supported the need that safety net services were essential always, but particularly in this pandemic. And you're exactly right. All of those things you said are happening. They were happening before the pandemic, and now they're happening on a greater scale. So we have continued to provide virtual services, whether it be therapy, even our home visiting parent support. We're doing those sessions virtually and observing families. Our buildings are open now that the stay-at-home lifted, but most families still want virtual services. People are really not ready to be face-to-face in offices yet. So we're going to continue to provide the services the best way that we can and reach the most people that we can.
And when you talk about the virtual services, how does that connect with the people? Is it more difficult or easier for some people?
It really depends on the person and the family, like you'd expect. We do our best to individualize services. A lot of our clients are involved in multi-systems, multi-generational systems in foster care or in intergenerational poverty, a lot of criminal justice involvement. There are families that are in multiple systems. And so their lives are more chaotic. Some of our clients don't have their driver's license or access to good transportation. So for some, going virtual has actually increased their engagement and their involvement because very few of our clients don't have access to a tablet, a computer, or even just a phone to do something virtually. And so for a good amount of our clients, engagement and participation has actually gone up. Newer clients, it's harder to engage virtually. People aren't quite ready necessarily on the first time they're getting therapy to do that virtually, but we have strategies to welcome and engage them beyond that. We will see someone in the office face to face if they really need that and they want it. We have the safety precautions in place. But frankly, doing therapy with a mask on, or, because all the offices are not 6 feet apart, is less engaging and feels less comfortable than doing it like we're doing our interview now, because at least we can see each other's full facial expressions. So we have actually found more people, eager and willing to try virtual than not.
Jaimie Clayton with us. She is the president and CEO of Oakland Family Services, joining us today on the Oakland County MegaCast. Jaimie, let's talk a little bit about mental health care during this time, because we have seen that there's been various tolls being taken on people of all different kinds in all different areas in Oakland County, in the state of Michigan, and throughout the country. In terms of mental health care, how have your services changed, and what are some major holes in services in our local area that you're helping to bridge on that front?
Yeah, Oakland County is actually very lucky. We have a very strong continuum of services. One area that Oakland Family Services fills specifically is we take Medicaid. We take nearly all the Medicaid different HMOs that there are, and many providers can't afford to do that. The biggest issue with mental health is we are underfunded dramatically for one of the most critical services that there is. So, for example, Oakland Family Services can lose anywhere from $40 to $70 per session that we provide, just because we use Medicaid, take Medicaid as a provider, and we don't get reimbursed the actual cost. So we use grants to supplement that, because we feel as a safety net provider, taking Medicaid, which you have a huge amount of people, especially with Medicaid expansion on in our area. And as I was saying before, we deal with a population that's high in need, that lives in poverty, or is pulling multiple jobs together and is what we in the industry calls underinsured. They have insurance, but it doesn't cover everything fully, or they can't access it because they can't afford their deductible. So we're using grants to offset that loss in cost, and also to help people if they can't afford copays necessarily in a time of this high of need. I will say that while demand has gone up, follow through on engaging in treatment in some situations has gone down. And that is not uncommon. We saw the same thing in 2008 when there was the financial fallout in the recession. People who have high deductibles or copays, if you think about Maslow's hierarchy of needs, are you worrying about your food and paying your bills versus a deductible for a therapy session or a copay? You might see that as an extravagance when we see it as basic needs, right? We consider mental health treatment a basic need, a basic health need at this point. So we're really working to encourage people when they reach out to engage in those sessions. Typically, once people start, they keep coming. So we've seen those demands, and we're working hard to be sure that our therapists are, have a bunch of different times that we're available. So we do early sessions in the morning, we do later sessions in the evening for those people who are not unemployed and are currently working and working to maintain that employment. We're working hard with moms who have kids home virtually. And don't know what to do and how to fit in their session. One of the struggles virtually is people feeling like they have confidentiality in their own home. So our therapists, we've done a lot of offering resources and training around helping people switch that mindset and modality. If you're getting treatment someplace else, what does that look like so that people will still engage? And making a lot of resources available and normalizing people's stress level. A lot of our clients engaged before the pandemic because they had other mental health issues going on. And so now all of this on top of that is really making these times even more stressful. So offering the opportunities to schedule and engage when it works for people most, ensuring that we have a wide swath of availability. And for our therapists, my therapists are all working remotely. So it kind of takes those regional boundaries down. So my therapists have typically worked at different locations, and that doesn't matter anymore. We can increase our availability because people can serve anybody anywhere. And so that's really where we're aiming for.
I love that you're bringing up mental health because prior to the pandemic, I feel like this was a huge issue that was on the back burner that wasn't being discussed enough. However, now it is being pushed to the forefront, and it is more comfortable and more acceptable for people to start talking about mental health issues. But let's say I'm a parent at home, stressed, trying to work remotely, teach my kid remotely, and trying to make ends meet, paying the bills. How do you know when to seek help and when you're just overstressed?
So I think it's a really individual decision. At Oakland Family Services, we talk about the moment of truth, that everybody has this moment where they're suddenly ready in a different way. I think it's great that a lot of our national publications have been putting mental health out there as a primary concern and again, normalizing people's stress. What we say is you don't have to be in a major depression or having panic attacks to seek help. Like therapy, counseling, support, whatever you want to call it. Sometimes we just need something outside of our world, something more objective. And I think while we've all been stuck at home, we've talked, I've been talking to people about their marriages and their relationships, and those are under more stress than ever. Whoever imagined being home all the time and maybe sharing workspace with your partner, plus trying to manage your kids at home. And so one thing that virtual therapy does afford is an opportunity to be outside that circle. And you don't have to have a major mental health diagnosis versus what you just mentioned, which was just being stressed. Just being stressed is enough, especially under these circumstances, to seek help. We try really hard to work against this stigma that you're mentally ill to get behavioral health counseling. Those are two very different things. And everybody needs some level of support. And if all the people in your life are super, super stressed and doing all of that balancing act, it may just be talking to somebody outside your circle helps you be centered and have the time that you need to prioritize yourself. Not all of us are doing the best job taking care of ourselves through this pandemic. We may be doing what we need to not get COVID. But that doesn't mean that we're taking care of our emotional needs and how we think and how we act. It's overwhelming for the highest functioning people. And so there is no stigma about talking to someone and getting additional insights and supports and coping strategies so that you don't end up in a different place on that spectrum of mental health issues.
Jaimie Clayton with us. She is the president and the CEO of Oakland Family Service with us on the Oakland County MegaCast today. Jaimie, just a few more minutes with you today before we let you go. Before we do, let's talk about a grant that your organization recently acquired from the Balmer Group. Oh, it's a $1.2 million grant with organizations in our community that are already working overtime and have been financially strapped throughout the pandemic. How critical are these funds to your operation, and where is this money going to be put to use?
We're so thrilled to announce our partnership with Balmer Group. So it's a 3-year grant. That $1.2 million is across 3 years, actually critical. Lots of foundation and funders have stepped up during COVID to do emergency funding. What this funding does is it funds organizational capacity, which not all funders do. Many funders and donors want to do something very specific to a program, which is wonderful. We need program support as well. But nonprofits run skinny, as I'm sure you all know. We end up needing to advertise how little we spend on administration, even though administration is what keeps the agency going. It's a very odd dichotomy in the world of nonprofits. And Balmer has identified the need in COVID for the safety net to continue. And so the grant will allow us to stabilize services currently, but also to look at our future sustainability. So it allows us to continue to invest internally to look at our early childhood programming. We stream together many different funding sources just to support the staffing levels that we have. We'd like to look at new ways to get funding and to bring people in to build size and scale and sustainability over time. The same thing in our day one program, which is our treatment arm of what we do, behavioral health. We're still fee for service primarily, and we're investigating alternative ways to be paid for performance, value-based reimbursement, which will have a longer sustainability for us. As I was indicating, we are committed to continuing to accept Medicaid, but how long is it sustainable if we lose $40 to $70 every time we provide treatment to somebody? That's not a sustainable model. And so Balmer is investing in us to say that we can take that money, use it to build internal resource and capacity for the long-term haul of the agency. Oakland Family Services are celebrating our 100th anniversary this year, and we want 100 more, and the pandemic's not going to stop us. And this money really frees us up to plan and think and be strategic moving forward while still ensuring that we don't miss a beat in providing services for the people who need it most right now.
Jaimie Clayton with us on the Oakland County MegaCast. She is the president and CEO, Oakland Family Services. Such great work that you and your team are doing over there, and we appreciate everything you are doing to keep us safe during this pandemic. Quickly, before we let you go, if someone is listening or watching this right now, how can they reach out to you and your team if they do feel like maybe they do need help?
That's great. Thank you. They can call our main number, 248-858-7766. That number will walk you through some steps to speak to somebody immediately to get scheduled for an appointment or just to get information. We're also on the web, of course, www.oaklandfamilyservices.org. And we're all over social media. If you look for Oakland Family Services on Facebook, Twitter, Instagram, and YouTube, and all of those have access points to get information on how to access our treatment. Can't miss us.
Well, thank you for sharing that with us, and we want to let people know it's okay to reach out and ask for help. We are all experiencing things that are different during this time, and if you're overwhelmed, please, there is no stigma. Pick up the phone, make a phone call, and ask for help. Jaimie, thank you again for your time. We appreciate it.
Thank you for having me.